I want to thank you all for having us here today. I do think it's a really great potential partnership, and as mentioned, we don't have a ton of engagement in our program in this part of the state, and so I'm excited to be here to just share some more information, but also would love to hear from you. Please ask questions. Informal and easy, so as long as everybody's okay with that, I am. But you know, we would love to hear if you're listening and you're like, I can't do that for these 10 reasons. I want to know that as well, and I'll give you some examples of other ways that you can provide us with feedback throughout the year as well. I will back up and say I'm Julie DeSimone. I'm the Director of Community Health at the New Jersey Healthcare Quality Institute, and we are the only independent, nonpartisan advocate for healthcare quality in New Jersey. We have 3 main buckets of work, which include policy, quality improvement, and then community health. And so community health is my area of work and where we'll spend our time this evening. How many of you are familiar with Mayor's Wellness Campaign? Okay, so not a ton, maybe a third at best, so that's good. For those of you who raise your hands, do you have active Mayor's Wellness campaigns in your town that you know of? Yes.
Not yet.
What town are you from?
Brigantine.
Okay, yep, how about you?
Carver City.
Okay. Anyone else who has one? Okay. So that's why I'm here. So if you are not familiar with the program, it is a statewide community health initiative where we partner with the state, with the League of Municipalities. Our goal is really to provide mayors and community leaders like yourselves with really actionable evidence-based tools and resources to help you to improve the health and wellness of your program. Amy or Rob, I can't remember, said it best when they really talked about that umbrella. There are so few things that cannot be really included under the umbrella of Mayor's Wellness Campaign. I have people call me all the time and they're like, I had this really great speaker come and talk about mental health, but I also serve pizza. Does that still count? Yes, it still counts. It's okay to serve pizza. You know, we're not looking at it that closely. Our goal is really to just increase access to health and wellness activities throughout the state. It also really gives the platform for mayors and other community leaders to really just make their community a healthier place to live, but also to let residents know about all the work you're doing. You mentioned libraries, recreation departments, boards of health. A lot of your towns are already doing this work, and it's really just about pulling it together. It's not about recreating the wheel or even about implementing new programs, but just thinking about them differently and just showing your residents and your community members that this is a town that values health and wellness, and here's all the things that we're doing to show you that. So some benefits to participating in the program. First of all, I guess I should say it's free. There is no cost to participate. The trade-off there is that we don't give you any money either, so it's really fair. That's something that we're working on. We are trying to really, as I'll talk about later, we really do solicit a lot of feedback from our partners, and we know that one of the challenges is having the resources to do some of this programming. So I'll talk a little bit about that later, but we unfortunately at this time do not offer like a sustainable and regular amount of funding to run the program. But that being said, we do offer support and technical assistance. Myself and my colleague Katie are always available to have phone calls, to come out to meetings, to meet with your mayor, to meet with your green teams, to answer any questions that you might have, or to help you advocate for why you want a program in your community. We'll also help you if you say to me, I really want to host a health fair, but I've never done that before. Can you give me some guidance on that? We're happy to walk you through you know, providing that type of programming. I'll talk a little bit more later about the tools that we have. We have a lot of really tangible tools that will walk you through step by step how to do some of these different programs. You'll also receive a quarterly newsletter. Go ahead, do you have a question?
Yeah, is it online?
Yes.
Newsletter?
Yeah, the newsletter you would have to sign up for, so I'll give you some information on how to get in touch with us. The tools, a lot of them are on that back table there that I left, and you can scan some QR codes to access those. So everything is free and on our website if you look hard enough, but I brought some with me so that you don't have to look too hard later. The newsletter, like I said, goes out quarterly. In that newsletter, we not only will let you know about our own activities and events and things for you to participate in, but we also will let you know if there is funding opportunities coming up in the state, if there are statewide programs that you might be able to take advantage of. We also try to highlight the work that the communities are doing. We know that some of the best ways for you to get work done is to see an example of that in a community that looks like yours, and then connect you to those folks, kind of like what you guys come here to do, to really just network with people who are doing similar programs as you. So we love to hear about what you're doing so that we can share that with the state. Connections to local partners. I didn't spend a ton of time on it, but the Quality Institute is also a membership organization. We work with almost all of the local health systems in the state with a ton of different providers. Really anyone that you can think of in the healthcare space, we have some connections to that. And so one of the benefits to being part of the Mayor's Wellness Campaign is if you say to me, I want somebody to come in and talk about diabetes management, or I need somebody to come and do blood pressure screenings at my event, it's very likely that we'll know someone not only who can do that, but somebody local to your community. That's important to us in a statewide program, to be able to offer those local connections so that they're sustainable for you going forward. We offer press kits. You know, again, sometimes this is really about the messaging and getting the word out. There's so many great programs that towns are running, and sometimes you have this, you know, you put all this work into an event and 7 people show up, and I know that that's really tough. We have some tools to help you push those programs out and hopefully support your efforts in just marketing, for lack of a better word, the work that you're doing. Networking, one of the things that we do are annually I run 21 focus groups across the state, and I do 1 in each county, and that's a really important way for us to solicit feedback from you guys who are running programs in the community. I will say, in Cape May and Atlantic County, I think nobody showed up to the Atlantic one last year, and these are virtual, so you don't have to come see me in Princeton, and I don't have to come down here. I don't think anyone showed up to the Atlantic one, and in Cape May County, Wildwood Crest is our shining star, and they're always there, and I always love my one-on-one chat with Mayor Cabrera, but we would love to have more feedback from other people throughout those areas. So, and I'll talk a little bit more about this later, but those focus groups to me, aside from the lack of attendance in some different, you know, some of those counties, are really the most valuable thing that we do. We don't have a ton of capacity. It's a statewide program, and it's me and one other staff person working on this. I want to make sure that we are spending our time on the things that you want us to spend our time on, and the things that are useful to you and that are meaningful for you in that time. So we really do use that feedback pretty seriously. And so I encourage you to encourage your mayors or your public health officers or yourselves, if you do get involved with the Mayor's Wellness Campaign, to participate in those. I mentioned we do offer information about funding opportunities, and when we do have the opportunity to offer funding directly, then by being part of the Mayor's Wellness Campaign, you have access to that. And then you have the opportunity to receive a Healthy Town designation, which I will talk a little bit about later. Oh, just kidding, I'll talk about it right now. So our Healthy Town designation is an annual application. It is currently open right now. It's open we open it down to the League of Municipalities. It's open from November and then closes in January. This is, I'm saying some of these things because there's been confusion around it in the past. This is an annual designation, so you do have to, your town has to apply every year in order to get the designation. There's 3 tiers that you can receive. Our gold is the Healthy Town, silver is Healthy Town to Watch, and then for bronze, the Healthy Town Up and Coming. It is a competitive process. We use a rubric and an application. Just to give you a sense, we probably have about 200 to 250 active communities running programs across the state. Last year, we awarded 38 designations. So it really is an example of kind of the top tier programs in the states. It's towns who are showing us that they are using data and research to drive their programming. It's towns that are looking at health broadly and not just, it's important to offer physical education activities, but we also want to see you looking at mental health and food insecurity and some of those other areas, and that's where the partnership with Sustainable Jersey is really a nice blend, because it really encourages you to think about all of those different pieces. It also looks at how you're evaluating your programs, if you're evaluating your programs, and if you are actually using that feedback to improve the programs. So we are looking at quite a few things for these towns. It's not something that I necessarily recommend for a startup town to apply for. It's something we're looking for those current applications that are open now. We're looking at programming that happened in 2023. So this time of year is a really great time to start thinking about applying for next year. You can use the rubric to really plan your programming for the year so that you can set yourself up for success in that application. We do have a Healthy Town technical assistance webinar on Tuesday. If anybody is interested in that, to just get more information about the application and part of the process, you're more than welcome to join just to learn a little bit more about that. Here's just a list of towns. I know it's kind of hard to read up there, but these are the towns that were awarded in 2022. We do see many of these towns kind of come back for their designation going forward, but this list has really been growing. I think the first year that we got here, that I was here, we had 22, and now we're up to that 38. So, to me that shows the interest in the program, but also the quality of the programs are really growing as well. I'm gonna use my notes a little bit more here because I want to make sure I get the points part right, and I often don't, and so you'll excuse me for that. But again, this is a really great partnership. I want to thank Lauren for bringing my name into this room because it really, we see so many towns who use their green team as such a good partner with their mayor's wellness campaign. It really is a good fit. They don't each check all of each other's boxes, but there's a lot that aligns in the middle and makes it, I think, hopefully easy for towns to do both. So the Sustainable Jersey Action Building Healthier Community awards points, to municipalities that have implemented educational and community-based programs and strategies aimed at engaging and empowering individuals to choose healthy behaviors and make changes that reduce their risk of developing chronic disease. And so municipalities who participate in the Mayor's Wellness Campaign at varying levels, but if you applied for a Healthy Town designation and were awarded in the previous year, you can earn the full 25 points for the Building Healthier Community Action. So I know that a lot of those towns that are submitting those applications, that the driver is because they want to be able to also achieve this action through Sustainable Jersey. So it really does check a lot of those boxes. And also, if you sign the pledge on an annual basis, if your mayor signs the pledge on an annual basis, you can get 5 points towards the Building Healthier Communities action. So again, probably work that you're already doing. The application is not minimal, but it's not a huge heavy lift, I think you'll find, especially if some of these things are already in place. So it really is a good way to kind of meld the two programs. Just some examples of things that towns are doing. And I really want to stress, like, I don't think there are two towns in this state that are doing this program the same way. We really do believe that this is not a one-size-fits-all program. We have guidelines, we have best practices, we have examples of things that we think are a good way to start. But at the end of the day, we don't pretend to be experts in every single one of your communities across the state. New Jersey is such a diverse state. Each of your communities has different needs, and so we really do leave it up to you guys at the local level to decide what works for your community. We have some towns that will have programs that are really based in their recreation department. We have some towns where it's really their green teams and their Sustainable Jersey efforts. There's some towns that are going to use all of the programming that they're offering through the library system or their senior centers or their board of health. And then we have towns that it's really a grassroots effort of true volunteer residents who are just kind of picking pieces out of everything that they really see and make sense. We're excited about all of it. The goal is really just to increase the access and the quality of health and wellness activities that are offered to your residents. So just some examples of things that towns were doing, offering those health screenings, especially during and kind of post-COVID, if we're post-COVID. We saw that really increase, hosting vaccine clinics. You see Patterson up there, they are breaking ground on a new all-inclusive playground for residents of all abilities. Stigma-free walks, that's something, mental health is something that we've really been focused on. I'll talk a little bit more about that later. And then some fun runs. Healthy cooking classes. We also see towns who will run yoga classes for older adults. We see towns who will integrate their education programs into the school. So there's just so many different options, and I'm always happy to talk through what you think makes sense for your community. Just a little bit more on the resources that we have available to you. The Mayor's Wellness Campaign Handbook, there are a couple of them on the back table. I actually have more, so I'll put those out before I have to head out in case you want them. That to me is really the best place to start if you're not familiar with the program. It is a little bit lengthy, but I often recommend take a look at that, and then when you have questions, give me a call afterwards. It really sets the framework. It walks you through the steps of how to participate, how to join the program, kind of what the first couple of things that we would want you to do, which, just so that you know, our recommendations are to really have a committee. In some towns, it is literally just the green team, and they're working in tandem, and we love that. In some towns, it might be an agenda item on the Board of Health. We know that people are not necessarily looking for another committee or another hat to wear. Again, we're not asking anybody to reinvent the wheel. And then in some communities, it is a standalone Mayor's Wellness Committee. If I'm being honest, that's my preference. I think when you have a really clear goal that you're focused on, it's going to work the best, but we just know that capacity can be a really big issue, especially in some of the smaller communities. So, you have to do what works for you. We give you some recommendations on who we think should be invited to the table to have those conversations, but at the end of the day, it really depends on what your goals are. The other thing that we ask folks to do, which we know is a big ask, is to do some kind of local needs assessment in some way. I know that is a challenge. I know that local data is hard to find, quality local data is hard to find, and even though there are a lot of resources that we direct you to in that handbook, I fully understand that especially that county level data does not always reflect the local communities, but we encourage you to do the best that you can. At the end of the day, we just don't want you to be picking programs out of thin air because they sound nice. The hope is that you have some understanding of what the needs of your community are and that you're using your programming to address those needs. And it can really be as simple as that. We also give you some examples and guidance on how to have a town hall meeting, how to do a resident survey if that's something that you're interested in doing, and we have examples of those so that you don't have to create them from scratch and you can kind of make them your own. I mentioned that we have a toolkit. We do have a 30 tool evidence-based toolkit that just gives you kind of one-off programs. So if you said to me, I'm really interested in doing something around nutrition education, I could probably show you a tool that would relate to that. If you want to do a physical exercise class, I could show you a tool related to that. We try to take the legwork out. Again, we know that many people are volunteers or they're wearing multiple hats, so we try to make it as easy as possible for people to really run these programs. Some of the toolkits that we've created more recently, as a result of those focus groups and the data that we've received from that, probably obviously this one was coming off of the heels of the pandemic, reducing social isolation program, where we really walk you through how to develop a volunteer match program. The program is technically geared towards older adults, but I think it works for anybody. We know there's been so much research and data, especially after the pandemic, about loneliness and social connectedness and the importance of combating that loneliness with that social connectedness. And so I think that's a really great tool if that's something that you're interested in looking at. We also focus on social determinants of health. Last summer we put out 2 tools, one related to food insecurity and the other related to land use programming, and so those are available to you, and we hope to be able to provide some more tools in that from that social determinants of health umbrella. So if you have ideas about the ones that are kind of most important to your community, let us know about that as well. Again, as a result of those focus groups, every single year since we've done those, in every single county, the top need that has been identified has been mental health. Again, we started doing those in the wake of the pandemic, so as a social worker, that does not surprise me, but I'm really glad to see people paying attention to an issue that is definitely not a new one. Through funding through the Horizon Foundation for New Jersey, we were able to develop a mental health toolkit. This is, again, a pretty comprehensive toolkit that really walks you through 3 main things. Basic education on mental health. We recognize that a lot of people, specifically mayors, but also staff who might be responsible for some of these programs, are not mental health experts, and we wouldn't expect them to be. So we did provide some just basic mental health education. We walk you through some really concrete macro level, kind of community level interventions to address mental health in your community, education programs, training programs, how to connect your residents to resources resources for mental health if they need that. The link to that is on the back table. It's a great place to start, and again, I'm here to support you in that work.
Where does that take you? That's great.
Yeah, so this is from Norwood, and they called this Canvas of Hope, and this was during the pandemic, and they encouraged residents to put up these kind of messages of hope, since this was really at the height of no one was interacting, we weren't seeing each other at all, and it was this nice visual in the town to just kind of bring that community piece, again, those positive messages. So yeah, really nice, and again, you don't need to be a mental health professional to administer a program like that, right? So there's some really kind of, in my opinion, low-hanging fruit, ways that we can bring the community together around this topic. The other thing that we are offering, and we are continuing to offer this, and if anyone is interested in these, please let me know, mental health first aid trainings. How many people are familiar with that training? Mental health first aid? Okay, just a couple. So mental health first aid is essentially a mental health training that is kind of modeled after a CPR training. So I think a lot of us, we might be trained in CPR, or at least aware that that's a training that you can receive. It's an 8-hour training, so it's not a small commitment. I understand that. We do them virtually because of the statewide nature of the program. It helps you to identify signs and symptoms of a mental health crisis. It gives you the tools to really address that crisis in the moment, and then the skills and kind of background knowledge to help get a person in crisis connected to resources that they may need. I am the trainer. I'm a little bit biased. It's just the best training, not just mine, but the curriculum in general is really something that I think every person can benefit from. I know mental health is such a common issue right now. We all know somebody who is struggling, or we are struggling ourselves, or we have a colleague, or our professional lives bring us to people who are struggling in this way. The training it's a national program, it's an international program. The curriculum is evidence-based. It is really something that I genuinely feel that any person can benefit from. We've had so much positive feedback. We have trained mayors, we've trained law enforcement, we've trained residents who just felt like this was something that they wanted to know more about. As you can tell, yes.
Is it 8 hours all in one shot, or is it?
It is. No, so there's 2 hours of pre-work, and then it's a 6-hour pre-work that you do before the training, and then it's a 6-hour virtual day. It's a lot. It's a heavy topics, but I think, again, we really have only received positive feedback from them. I have people reach out to me a year later and say, I just had this issue and I was able to respond to it because of what I learned in your class. I mean, that's really what's important.
How often do you offer it?
So we offer, right now, because we have 2 different kind of funding sources for that, we're offering 8 in this cycle, which means that there's 6 left. So we usually do 1 a month. I should mention 3 of those 6 are adult trainings and 3 are youth. Both are intended for adult populations to take the class, but the youth training is for people who might be working more with young people. I'll be honest, the curriculum is not that different. Either is beneficial. The real difference in the curriculum are the scenarios and the videos that you would watch, but the real bulk of the curriculum is the same. So either one would probably be helpful. So I can, again, if that's something you're interested in, we actually have one coming up on December 13th that has space. So we would love to get people involved. And I guess I probably didn't mention, but I should, it's free, and something that we would love to just get as many people in New Jersey trained in as we can. And you do get a certification at the end of the day through the National Council on Wellbeing. You will be a certified mental health first aider. So for some, people in their professional lives, that's helpful too. Any other questions on that? Okay. And yeah, like I mentioned, we are happy to kind of walk you through starting up any of these programs that you might need support on. I said earlier that we don't offer funding, and I was lying a little bit. This year, we were really excited. Again, I've said it 3 times already in a short amount of time, which I'm almost done. We really heard folks say that funding was an issue and mental health was an issue. So we were able to partner with the League of Municipalities, funded by Walmart, to offer $127,000 of grant funding to 10 of our Mayor's Wellness Campaign communities. Again, if you were not part of the Mayor's Wellness Campaign, you were not eligible for that funding, so a benefit of being part of it. We did receive over $700,000 of requests. Clearly the need far exceeds our ability to fund those, but we're still really excited about the programs that are going to be able to be funded through this. So there will be more information. The grant period just started, but you'll see more about what these towns are doing to address mental health in their community. And we do hope that this is going to be an ongoing opportunity for towns to apply for each year. And that's it. So I just want to thank our sponsors. We would not be able to do this work for all of you statewide without their support. And if any,
completely funded by sponsors?
we have a various different, so like the Horizon funding is grant funded, the Walmart funding is grant funded, we're a membership organization, and then we do a specific sponsorship campaigns for the Mayor's Wellness Campaign, so it really depends. And we have some smaller contracts and grants as well, depending on the project.
Thank you.
Any questions? If I can take questions, is that okay? Yeah.
Quick question, where do you get a copy of your signature? Because I think we need that to apply for the Healthy Communities Action.
Yeah, so if your mayor already signed the pledge, you can just email me and you can send it, and I'll send it to you.
But I didn't sign it at the league. I usually do it online.
Yeah, I have it. Yeah.
Okay.
Yeah, if you just email me for a copy, you can let me know.
From your experience, which program do you find has the most turnout, the fun run, or what do you see is really people like?
I think the ones that are really embedded in the community and have the kind of historical nature in the community really bring out the most. I know that's not helpful if you're starting a program, but I think it's the ones where every year we do this program. The other thing that I think really helps is, especially if you're just starting, is to add something on to a pre-existing event. So, when you're having a health fair, add the flu shots or add the blood pressure screening there. Or if you're having you know, like a family fun night, like a movie screening, like add a table about mental health stigma so that because are people gonna really get super excited to come out and just get their flu shot or come out and just get their blood pressure screening unless they have a reason to do that? Probably not, but I think when you kind of combine some of those more fun community events and then integrate the health and wellness pieces into them, that can be really helpful. I know that doesn't work for all of them, but I do think it's a good strategy, you know, for getting people who you might not otherwise get for some of those health-focused activities. And it's always nice to, as you know, offer incentives, offer food. If you feed them, they will come. I know that's not always possible, but. Any other questions? Yes?
I'm sorry, I apologize. I have a question. So the green team in my town is not quite 2 years old, but our mayor has agreed to do the mayor's wellness campaign,
Great.
which is really exciting. But it's a town of 1,090 people.
Yeah.
We don't have a library. We don't have a recreation department.
Yep.
We don't have any of the things you talked about.
Yeah.
So I wonder if there's other towns that have successfully done this
Yeah.
that I could reach out to, because, you know, when you're saying, you know,
Yep, I get it.
we just,
Yeah.
we're excited, she's excited.
Yep.
I'm excited that, you know, the mayor is fully in support of this, but it's hard for me to imagine some of the things you mentioned, given the fact that we don't.
Yeah, you don't even have enough people to come to, I get it, yeah. So I think there's a couple strategies there. I think one of them is partnering with a neighboring community. That is something that we see all the time. Not gonna
But
happen.
when I looked it up, you know, you're right, this area is, Egg Harbor City has a mayor's wellness campaign, but I was looking to partner, you know,
Okay.
I was looking and we're not.
Well, maybe this is the.
Yeah, let's
incentive,
go, let's get
right?
them, we'll help you, yeah. So I think the other thing too is thinking about, I'll just give one quick example. In Scotch Plains, they are a smaller community, admittedly an affluent community, lots of resources, but they have a ton of organizations that do events, that do programming in their town. They technically, their township does not actually host any activities, but what they do is they partner to really push out all of the activities being offered by all those other organizations. Again, we're not paying you to do this, so you do what makes sense for you. What they're doing is making sure that residents know, and of course they get they're partnering with those communities, so they're not just slapping their mayor's wellness campaign logo on all these things. They're bringing all of those partner organizations who are already doing the work in their communities to the table and saying, how can we collectively pool our resources to get this information out? So even if you have a small town, it's unlikely that you don't have some stuff going on in that town, and how can you don't have anything? All right, well, let's talk.
I'm not.
No, I'm just,
Don't go back.
I said it, she did it. No, it's okay.
Well, you know, we had our very first Earth Fair because the green teams started.
Yeah.
You know what I'm saying? That was last year. I mean,
Yeah.
It was this year. It's a town that.
Yeah. All right, let's talk, because I think there's some ways that we can do it. I don't want to, Anyone else?